I was 21 years old and I was diagnosed with Hodgkin's lymphoma and treated with radiation therapy, and started graduate school after that, and my Hodgkin's lymphoma came back and I had to have chemotherapy and go through all the months of that. And then I was fine for 20 years, and then I had esophageal carcinoma as a second cancer that was likely caused by the radiation therapy. So I was a new investigator at the University of Wisconsin, and writing grants furiously, because that's what you do when you start your lab. You need to get money to get your program going. And the first major research grant I got was a research scholar grant from the American Cancer Society. And cancer was a very interesting question, understanding how cancer spreads. And so I became interested in looking at cancer cells and how they migrate and walk basically through connective tissues. We are looking at how breast cancer cells move from the tumor out through the connective tissue and then into the bloodstream and spread throughout the body. And we have discovered changes in the connective tissue, especially one of the proteins called collagen that's very predominant there. And what we've found is that the collagen aligns relative to the tumor, and it actually works as a surface on which the tumor cells can crawl out and spread. And so we're using this in a couple of different ways. One is we can see these changes very early in breast cancer, and so we're hoping that this can be developed as a way to determine which patients have very aggressive disease and which patients have more benign disease. We also hope that it will help physicians know when they've gotten the tumor margin, because this connective tissue change turns out to be part of the tumor margin. It wasn't initially appreciated that that was part of the tumor. And so a lot of patients have to come back to have more of the tumor removed. And if we right away could say, oh wait, there's this collagen looks like this, you better go take more while the patient's right there, I think that would benefit patients. And then we've also discovered certain drugs and inhibitors that, at least in our culture models and in animal models, are having effects to block this process of spreading and walking on the collagen. So we're hoping that we can maybe find a drug or a cure that specifically targets that spread. If my grant hadn't been funded, I don't think we would have gone in the direction we went in, because that was one project, and I had a different project that I thought was going to be the core of my grant, of my laboratory. But this project that was funded by the American Cancer Society became the driving force, and it would not have happened without generating more dollars. And I see, even with the pilot projects now that I'm helping to distribute, these are not large grants, these small grants, but they really make a difference for these young investigators. And so I think every effort to get bits of money that can help get somebody engaged, help attract a researcher in another field into cancer research, I think these are all valuable things for the endeavor, for the goal of understanding cancer and finding cures for it.